Avoiding dental emergencies. Tips you need to know. Hi everyone, my name is Whitney and I'm a registered dental hygienist here to talk about avoiding dental emergencies because we all know that any type of tooth emergency can be a real pain, literally. But what many people don't know is that most of these emergencies can be avoided with 3 simple tips. Starting with, number 1, protect your teeth with guards. If you're into sports, wear a mouth guard during playing your sports. And if you clench or grind your teeth at night, be sure to protect your teeth with a night guard. And keep in mind that mouth guards and night guards are different. Mouth guards for sports will usually be a softer plastic, whereas night guards for sleeping will be hard plastic. You can't use the same one for both. They are designed for different things. Mouth guards for sports, night guards for clenching and grinding. Wearing the correct guard on your teeth can prevent broken teeth and other injuries that can lead to a dentist emergency visit. I've seen so many patients schedule emergency appointments from, of course, sports injuries, but even more so after they wake up in the morning with a chipped or broken tooth. They call the office and say, I don't know what happened. I was just sleeping and I woke up with a broken tooth and now I'm in pain. Clenching and grinding your teeth is definitely one of the most common causes of broken and chipped teeth, even sometimes requiring root canals. You can bang on a certain tooth night after night, hitting that same tooth until you've traumatized the nerve and it starts to die. So protect those pearly whites with night guards for sleep and mouth guards for sports. I will link night guard resources below if you'd like to learn more. Number 2, don't skip your regular dental checkups. It's easy to think that if nothing hurts, everything is fine. But avoiding those routine visits can actually increase your chances of running into an emergency visit later. Preventative care is better, easier, and more affordable than emergency care. Your dentist and dental hygienist, we can catch issues early like cavities, gum disease, or even early signs of infections before they give you pain and before they turn into something more serious. Again, when I was a dental assistant, I saw so many patients only schedule appointments when something was wrong, and they were in all the time because once one tooth broke, it was downhill from that, issue after issue, because they weren't coming in routinely to catch things when they were small. And then it became a domino effect. I would also notice the patients in the hygiene rooms getting their routine teeth cleanings, and I never recognized them because they were never in for any dental treatments on my side with the dentist. They were in and out with the hygienist for their cleanings every 6 months. I didn't even know who they were since their appointments were so simple and quick. Now that I'm a hygienist, I got to meet them. But yeah, rarely do patients with routine hygiene appointments have to schedule emergency restorative appointments. And lastly, number 3, on top of seeing your dentist regularly, a strong daily oral hygiene routine is truly your first line of defense. Brushing and flossing daily sounds so simple, but most people either don't do it correctly, they are brushing and flossing wrong at home, or they just don't do it at all. I will link my free oral care guide that goes over proper technique to make sure you are in fact brushing and flossing the right way. You always want to make sure that you brush twice each day and floss at least once each day, all while using proper technique. And you really should never skip a day because it only takes between 24 to 48 hours, give or take, for most people's teeth, some longer, some shorter, for plaque to harden into tartar. I'll link those videos of mine below if you want to learn more, but for the purpose of this video, I won't get too sciencey, so long story short, you don't want plaque turning into tartar. It increases your risk of a bunch of bad things that lead to dental emergencies. So don't skip brushing and flossing and make sure you're doing it right. Good habits at home can truly prevent dental emergencies. And speaking of good habits at home, along with good oral care, what you eat also plays a big role in your dental health. Sugary and acidic foods can wear down enamel and lead to tooth decay. So don't be sipping on Gatorade or juices all day. Try your best to limit sugary and acidic foods and drinks, and always rinse your mouth out with water after indulging in these sugary or acidic foods and drinks. And overall, listen to your mouth. If you start feeling any discomfort, whether it's a toothache, sensitivity, or swollen gums, don't ignore it. Don't ignore pain. Once you start to feel pain, oftentimes the tooth or teeth have already reached a severe state. Again, this is unlikely to happen if you're seeing your dentist routinely because they will take routine x-rays at your checkups and cleanings and catch things when they're small before they bother you. Catching problems early can save you from painful and costly emergencies down the road. And I hope this video helped you. Please like, subscribe, and turn on your notifications if you did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com. And I'll also link my free oral care guide below that I mentioned earlier. This guide is an action plan to help you create the perfect oral hygiene routine at home. It provides toothy tutorials, demos, and technique videos for you to confirm that you are in fact doing the right things to protect your teeth. And until next time, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.